In January, you treated gonorrhea. In February, you treated syphilis. In March, you developed foul smelling discharge.
Hey, child, there is God, oh. There is God, oh.
Hmm, this video is for you.
J5.
Hi guys, welcome back to my YouTube channel. I'm Dr. Hilda and my YouTube channel is about health and lifestyle. If it's your first time stopping by this channel, consider subscribing because there are a lot of things you can learn from and entertain yourself with. So in today's video, I want to talk to you all on reasons you keep having recurrent STDs. If there's something you'll want to know, sit back and enjoy this video. So STDs are a short form of sexually transmitted diseases. So sexually transmitted disease, just as the name implies, just means that it's a disease that is transmitted from one individual to another through sexual contact, be it oral, be it anal or vaginal. So sexually transmitted diseases are a thing that a lot of people deal with. Just here to tell you why you keep having recurrent STDs. And if you know the reason why you keep having these recurrent STDs, then you know how to avoid it, if you get what I mean. So my first reason is that you have been self-medicating. So self-medication just simply means that you feel a certain symptom and you just go by yourself to a pharmacy or anywhere you get your medication from without a doctor's prescription. So you just go and get to yourself. So the bad thing about self-medicating is that there are a lot of things that can cause these infections. It can be bacterial, it could be a viral cause. So how do you know what you're actually treating? So you're probably just going to get any antibiotic out of the blues to treat your symptoms. And how do you know that's what you have? You don't. The ideal thing for you to do is to go to a hospital where samples will be taken, a swab could be taken, and to be sent to a lab for an MCS, that's just a microscopic culture and sensitivity, which will go the particular organism to show the particular organism that is actually causing this infection. And it can even give an idea of the particular drug that will work in this particular infection. So you see that you've been wasting your time, putting your body at so much risk, taking so much drugs by self-medicating, and you're not properly treating what you have. That's why you may keep having these recurrent symptoms. After taking these drugs for a few days, you now see that these symptoms reoccur. That is why, because you're self-medicating and probably using the wrong drug for what you have. So if you feel any symptom, or be it itching, a foul-smelling discharge, or pain or urination, feel free to go to a hospital and speak to a doctor where you'll be properly assessed. So if you have done the right step by going to the hospital, kudos to you. So you've gone to the hospital, you've properly checked and assessed, and you've been given the particular antibiotic that will cure your illness or your disease, and you come back home. Just take it for 2 days, and because you notice improvement in these symptoms, you just toss it away, throw it in the bin. You feel like, oh, you've gotten back to your normal self.
You don't know nothing, but I'm gonna tell you something. And I'm saying,
Brother, it's cooking up in your bodies. So what you should do is that if you actually prescribe a drug and it says take this for 2 weeks, you should actually abide by what you've been given, abide by your rule, and just take it for 2 weeks and you'll be fine. Okay, so this is my third tip. Now you have done the proper thing by going to the hospital, you didn't self-medicate, they gave you drugs, you were very, very religious, you took it for 14 days morning and night, and the infection has actually cleared from your body, but you now reinfect yourself. That is my third tip why you keep having recurrent STDs, reinfection. So after you've been treated, reinfect yourself again. So if you do the right thing by going to the hospital and you've been treated for an STD, the right thing is that a contact tracing is going to be done. You're going to be asked about your sexual partners. You're also going to be asked to bring them to the hospital so you're properly treated. Because if you treat only yourself and you're fine and you go back to your sexual partner, you're going to reinfect yourself. This continuous reinfection, chronic STDs, can lead to complications. That's another topic for another day. So it's very important that you always go with your partner and you get treated and you stay away from those practices that are putting you at risk. Which brings me to my fourth reason: risky practices. So you've been having unprotected sexual intercourse, you're having multiple sexual partners, or you feel like you're good, you're religious, you have just one sexual partner, but your partner has various sexual partners. Do you know what that does to you?
You don't know nothing, but I'm gonna tell you something. And I'm saying
Automatically have multiple sexual partners, because those other partners that have those other infections, your partner is going to bring it back to you. It's very, very important that we actually learn good and safe sexual practices. Use your condoms, use your barrier protections, because they actually protect you from STDs in addition to preventing pregnancy. By the way, I'll just leave a card of my contraceptive videos. Just watch it if that's something you want to know. So these barrier contraceptives actually have an additional advantage of preventing the transmission of sexually transmitted infections. These are the 4 reasons why people keep having recurrent sexually transmitted diseases. So it's now up to you to make the right choice and practice safe sexual intercourse. I hope you've learned something from this video. Please give this video a thumbs up if you've enjoyed watching. It really goes a long way for me. Leave your comments if there are things you'd like to discuss with me. Feel free to leave in the comment section, or you can send me a DM on Instagram. Thank you for watching this video, and I'll see you in my next video. Bye.
Go, go, go.